Hello, welcome back to our channel. You're about to watch an informative and educational video on the role of nitric oxide in erectile physiology and its implications for the treatment of erectile dysfunction. But before you do, please like this video and subscribe to our channel. Now, without further ado, let's dive right in. Erectile dysfunction is a common condition affecting men of all ages, and while it is often considered a quality of life issue, it can also have a significant impact on self-esteem and relationships. In this video, we will explore the physiological mechanisms involved in erectile function, with a focus on the crucial role played by nitric oxide. We will also discuss exciting new developments in the field, including localized delivery of nitric oxide to the penis. Join us as we delve into the science behind this important topic and discover how new treatments could provide hope for those suffering from erectile dysfunction. The role of nitric oxide, NO, in erectile physiology is well documented. Nitric oxide activates relaxation of corporal cavernosal smooth muscle tissue, resulting in increased blood flow into the penis, resulting in an erection. At present, pharmacologic treatments for erectile dysfunction, such as the phosphodiesterase 5 inhibitors, potentiate the erectile response generated by nitric oxide. However, a new class of treatments at a preclinical stage may allow localized delivery of nitric oxide to the penis via cutaneous application. These treatments may be of particular value to patients with a neurogenic component to their erectile dysfunction, and may act synergistically with phosphodiesterase 5 inhibitors to increase their efficacy. Erectile dysfunction as a disease. Erectile dysfunction is defined as the inability of a man to achieve or maintain an erection sufficient for satisfactory sexual performance. Although considered primarily as a disease affecting the quality of life of a patient, erectile dysfunction is not only a physiological condition but also is associated with low self-esteem and deterioration in partner relationships. Depending on the cause, erectile dysfunction can be broadly classified as organic, psychogenic, or mixed. Psychogenic impotence is where an erection or penetration fails due to thoughts or feelings, psychological reasons, rather than physical pathology. Until the late 1960s, psychogenic reasons were thought to be the cause of the majority of cases of erectile dysfunction. However, following the development of surgical interventions in the 1950s, and pharmacological treatments in the 1990s that were able to successfully treat erectile dysfunction, this position has been totally reversed. Physiological factors are now considered to be the cause of erectile dysfunction in greater than 80% of patients. Two of the most common risk factors for organic erectile dysfunction are diabetes and senescence. Diabetic men are 3 times as likely to develop erectile dysfunction as non-diabetic men, and men aged 50 to 90 years have a 10 times greater risk for erectile dysfunction than those younger than 50 years. Go to the role of nitric oxide in erectile physiology. The role of nitric oxide, NO, in regulating vascular smooth muscle tone is well documented. Given that erectile physiology is dependent on increased blood flow into the penis through relaxation of the corpora cavernosal smooth muscle tissue, it is not surprising that nitric oxide plays an important role in the process. The initiation of penile erection is controlled by the parasympathetic and sympathetic branches of the autonomic nervous system. Nerve stimulation activates the release of nitric oxide from neuronal nitric oxide synthase, NNOS, 6. This then initiates a cascade effect, activating nitric oxide production in endothelial cells through endothelial and inducible NOS, eNOS, INOS. Nitric oxide then activates guanylate cyclase, which induces corporal smooth muscle relaxation by increasing intracellular cGMP, which primarily through activation of potassium channels inhibits calcium entry into the cell, thereby decreasing intracellular calcium concentrations. Intracellular calcium is the prime determinant of the activity of myosin light chain kinase. With lower calcium levels in the cell, the predominant direction of myosin is toward dephosphorylation, mediated through myosin light chain phosphatase, which leads to smooth muscle relaxation. Nitric oxide appears to have 2 roles in the development of an erection. A rapid, brief, calcium-dependent activation of NNOS initiates the erectile process, whereas PI3K, ACT-dependent phosphorylation of eNOS, results in sustained nitric oxide production and thereby enables full erection attainment. It is also possible that increased blood flow into the penis further stimulates nitric oxide production from nitrite. Nitric oxide pathways involved in erectile physiology. The initiation of penile erection is controlled by the parasympathetic and sympathetic branches of the autonomic nervous system. Nerve stimulation activates the release of nitric oxide from NNOS. This then initiates a cascade effect, activating nitric oxide production in endothelial cells through eNOS and iNOS. Nitric oxide then activates guanylate cyclase, which induces corporal smooth muscle relaxation by increasing intracellular cGMP, which primarily through activation of potassium channels inhibits calcium entry into the cell, thereby decreasing intracellular calcium concentrations. Intracellular calcium is the prime determinant of the activity of MLCK. With lower calcium levels in the cell, the predominant direction of myosin is toward dephosphorylation, mediated through MLCK, which leads to smooth muscle relaxation. Although nitric oxide is recognized as playing a central role in erectile physiology, until recently there were no therapeutics that could deliver nitric oxide locally. Therefore, most pharmacologic treatments of erectile dysfunction have focused on increasing the effect of nitric oxide that is generated in corporal tissue, or to increase the ability of this tissue to generate nitric oxide. Arginine supplementation to treat erectile dysfunction. L-arginine is the substrate for production of nitric oxide by NOS, and there have been several studies in patients and animal models to determine if arginine supplementation can improve erectile dysfunction. Although studies in animals suggested improved erectile function, the level of efficacy in patients chronically administered arginine remains uncertain. However, a recent study where oral arginine was combined with AMP showed some efficacy in patients with mild to moderate erectile dysfunction. Promising results have also been obtained in patients and animal models which are treated with L-citrulline. L-citrulline can be converted to L-arginine and has the potential advantage that it neither undergo first-pass metabolism nor it is metabolized by intestinal bacteria. In rats, L-citrulline supplementation was shown to increase penile levels of nitric oxide and improve erectile function, and in humans, it was shown to improve the erection hardness score in mild erectile dysfunction patients in a single-blind study. Now before you leave, are you looking for a way to improve your endurance, stamina, and alertness? Do you want to support a healthy heart and circulation? If so, you might be interested in our latest discovery, an improved nitric oxide boosting product. Improved nitric oxide is a cutting-edge supplement that helps boost the levels of nitric oxide in your body. Nitric oxide is a naturally occurring molecule that plays a crucial role in various physiological functions such as blood flow, erectile function, oxygen delivery, and nutrient uptake. By taking improved nitric oxide supplementation, you can experience a range of benefits, including improved erections and sexual performance, superior endurance and stamina, improved circulation, support for healthy blood pressure, a strong, healthy heart, improved alertness and focus, enhanced memory and cognition, higher energy levels, reduced fatigue. If you're interested in trying out improved nitric oxide supplementation for yourself, check out the link in the description below. But please keep in mind that this is not medical advice, and you should always consult with your doctor before taking any supplements. Thanks for watching. Please like this video and subscribe to our channel. In the meantime, live healthy ever after, and we'll see you in the next video.